My name is Yolanda. I'm age 47.
I have a third breast, and I want it gone.
It does not have a nipple, but every month, when I get my period, it would be sensitive to touch. I mean, it's embarrassing. Taking selfies, taking photos with friends. I have to position myself so that it's not showing or hanging or, that I have to push it back or pull it back, or I'll tell them, oh, not this side. I like to dance with my arms up,
Well, you can really see how that third breast does stick out when she lifts her arms up. Now, I see all the time women who come in with fullness right up in their armpit area here, and there are a lot of different options to treat that, from liposuction to injections of Kybella. But if it's breast tissue, it's a little bit different, and sometimes just liposuction may not get rid of it.
How are you? So nice to meet you.
Finally, nice to meet you too.
Tell me a little bit about the mass that you have.
Like, as my breast started developing more, it would grow.
Did you notice it change in size with pregnancy?
I did. Everything that my breast went through, I felt it under my arm.
So it acted the same as your breast tissue?
Yeah.
So that's kind of the crazy thing about accessory breast tissue, is that it really does often act like regular breast tissue. So if you're before your period and you're feeling kind of tender, then that area can feel tender too. Now the big question is can that area then create milk if you've had a baby? And the answer is that technically it should be able to, but even if it creates milk, there's no place for that milk to exit out because she doesn't have a nipple attached to that third breast.
Okay, so let me take a look at this mass. Oh yeah, it's sizable. Now when I squeeze like this on it, does it hurt you at all?
No, it doesn't.
Okay, great. It doesn't feel like it's densely attached to anything else.
Now, it's not uncommon that I see women who come in with this type of an issue. Now, hers is a bit more than what I usually see, but just like the doctor here was saying, is that typically that area feels pretty soft, it's mobile, and that's how you know that it's probably just a combination of mainly fat with maybe a little bit of breast tissue.
Is there anything else you'd like to ask me about?
Yes, I know that I'm here about this, but my breasts, I know that they're not perky like they used to be. Is it possible to fix them?
Hey, since we're in there, right? You might as well just make everything look perfect. So I would love to just put some breast implants if you're willing.
Yes, thank the Lord.
Now, I need to say that Dr. Q, Dr. Suzanne Quart, who is the plastic surgeon on this video, is well respected. She's a board certified plastic surgeon. But I think it's really important for plastic surgeons to avoid using the word perfect. When we tell our patients that they're going to look perfect afterwards, now we're putting into them expectations that are extremely, extremely high. And all plastic surgeons know that the body heals differently, one patient to another. And the other thing that bothers me a little bit with this interaction is breast implants are not just something to throw in. While we're there, let's put some breast implants in. Not at all. Breast implants are big deals. They are not lifetime devices. If you consider having breast augmentation, then you're going to have most likely multiple more operations in your lifetime.
So I'm just marking the outline of it. And we talked about how we'll be sending this to pathology, so you'll have a definite diagnosis, even though we think we know what it is.
Now, you may be watching this video and thinking that she is just kind of scribbling all over this patient, but believe it or not, all these markings do serve a purpose. And if you see my patients before surgery, they've got markings all over them, and each marking does make sense to me, which is the most important thing.
So we're gonna remove not only the accessory breast tissue, but also that extra skin to make it nice and flat.
Okay.
The challenge with these kind of axillary rolls that we see is that we would love to just take it out with liposuction. And my experience with treating these is that when you just liposuction that area, the skin ends up kind of saggy and drooping. It doesn't necessarily tighten up really well. And so to take the skin out, especially in something this big, I think is absolutely necessary.
For Yolanda's surgery, I will begin by giving her breast implants. Then I will make an incision across the third breast, in her armpit, and remove all the breast tissue.
Now you may be wondering, does this patient need a lift? The problem with a lift is that it creates a lot of scars, and typically the scars of a lift extend all the way around the areola, vertically down, and horizontally underneath the breast. That's a lot of scars. Now, because she has darker skin, she is at a higher risk of a darker and a thicker scar than a patient with lighter skin, and these may be reasons why she decided not to do a lift.
Starting Yolanda's surgery today with the breast augmentation portion of the procedure because it's a cleaner area and we want it super sterile to place these new breast implants.
That is so, so important. In surgery, you always go from clean to dirty. So whenever you're dealing with an actual implant, it is so incredibly important not to get any type of bacteria on that implant. So doing the breast implant surgery first is always what we want to do. So if I combine, let's say, breast implant surgery with, let's say, a nose job, the breast implants go first.
So going above the muscle can go a little quicker because we don't have to actually elevate the pectoralis, which is nice. I'm going to place Yolanda's breast implants above the muscle because if I put her breast implants below the muscle, I would absolutely have to do a breast lift for it to look good.
Now, Dr. Q here mentioned that she put the implants above the muscle, not below the muscle. And the reason why is that if you're not going to do a lift and the patient's pretty droopy and you go under the muscle, sometimes the muscle will hold the implant up a bit higher than it is when it's above the muscle. And if the implant's sitting too high and the breast tissue is sitting low, it can create what we call a waterfall deformity, otherwise known as a Snoopy deformity. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Oh, that's beautiful.
That's great.
That looks good. Okay, we're gonna do the same thing on the other side.
Now, there's nothing wrong with how Dr. Q is doing the operation and putting the implants in. However, in my practice, I use something called a funnel, where we actually put the implant into this funnel, and because it has a small little opening, we can then squeeze the implant into the breast without touching the implant at all. It is super, super slick, but believe it or not, something like this costs like $75.
We're gonna get ready to excise the mass. So on table, our mass seems to measure about 9 centimeters in length.
What's her story?
It started at the age of 14 and then grew and grew, and she just kept tucking it and hiding it. So as of right now, it looks just like fatty tissue. But we'll see if as we get deeper, if it looks more glandular in nature.
The breast is made out of two things, fat and glandular breast tissue. Fat is what you think it is. It's soft, it's globular, it doesn't have much shape or anything like that. Glandular tissue is very different. Glandular tissue, especially in younger women, has the consistency of styrofoam. Now, when women are younger, their breasts are made up of mainly glandular tissue with a smaller percentage of fat. But as women get older, as their breasts change, they become more fat and less glandular tissue. And that's why the breasts can droop with age.
Oh, there we go. You can see it better now. Here's our mass. But I think we're almost there. There we go. Oh. Okay, I got it in one piece. So, not a real definitive capsule. Looks mostly fatty, but there could be some glandular cells in there.
When I take these types of things off, it's mainly fat. You may see a little bit of glandular tissue there, but really it's kind of this soft, fatty substance. And that's why sometimes liposuction can really work for these areas, because even though there may be some glandular tissue, most of it's fat that can be sucked out.
Yeah. So now that the mass is out, I have to tailor these skin flaps and take out the extra skin. Okay, let's staple it and see if I'm happy.
We use staples in surgery as a temporary way to put skin together to see how things look before you take the time to suture it. The key is you take the staples out and suture it at the end. Unfortunately, I have seen patients who've had, let's say, breast reductions done by terrible plastic surgeons, and they closed all the incisions using staples. They've left the staples in for like 2 weeks, leaving this railroad track appearance to the scars. That is bad form in plastic surgery.
Okay, this looks amazing. I am happy. Okay, so we're putting in our very last stitches here. And instead of having 3 droopy boobs, now she got 2 perky boobs.
So this is a classic case of addition by subtraction. She has gone from 3 breasts to 2 breasts, and hopefully is going to be much happier afterwards.
Knock, knock. Hi, girl. Oh, you look amazing. Oh, my gosh. How are you feeling?
I feel amazing.
How are you feeling?
I feel incredible.
Look at these girls, girl.
It's all
That Dr. Q is a riot. I mean, I love my patients. I owe them my career. I owe them so much. But I never go up to them and like give them a massive bear hug. I mean, I don't do that to my dad, much less my patients.
Before I had the surgery and living with the extra boob under my arm, I would walk into a store, and if it was hot and I didn't have one of any sleeves, I have to remember to tuck the boob under my arm. Since my surgery, I have done it, and I have to remind myself that I don't have it anymore. I feel like I'm starting my life all over again, starting womanhood all over again, and I feel so beautiful.
Props to Dr. Q for giving Yolanda such a nice result. I think she looks fantastic. So Yolanda had 3 breasts and went down to 2, but what about an Instagram influencer with breasts that go almost all the way down to her waist? Well, take a peek at this video right up here where I react to an episode of Dr. 90210 with a breast reduction bigger than any you will probably ever see on TV. These are massive. And please subscribe to my channel if you've been enjoying it, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.